talk about anxiety, severe anxiety. Now, I'm saying this because I personally know someone who has been through it, and it was quite serious. Is it part of the bipolar disorder?
No. Anxiety disorder is a different disorder from this bipolar affective disorders. Yes. So I think at the appropriate time we will come and talk more on anxiety because you know anxiety is generally you fearing for the unknown. Assuming in life you don't know what the future holds. You are yet to marry, yet to get your own house, yet to go to school. You know, the thought of it, you thinking so much about it, that is more of the anxiety. But then bipolar is more of mood swings, mood disorders. Yes, mood disorders.
I
so
see.
that one is different.
Let's talk about some of the symptoms.
Okay.
It looks like you can't really identify someone who has it. What should we look out for in someone to know that, look, my brother or my sister or probably my dad, my husband is suffering from the bipolar? How do we get to
All right, so I'll tackle the manic aspect first.
Okay.
So mania, the person feels so happy at the time. They feel in their abilities. At a point in time, some even have hypersexuality. They can engage in reckless sex activities. Some can have sex morning, afternoon, evening, night, like almost every day because they are hyper.
Please repeat that aspect for me because...
All right, so you know, the person is high at the time. So the person experiences this increased energy to do things. So they engage in reckless sexual activities. They can go to the beach, go anywhere. You see them doing their own thing there. And that is another aspect of it. But then some also feel like they are so hyperactive to the extent that they don't even have time to eat. They don't have time for themselves. Some even neglect their personal hygiene. They are so high.
Hold on for me. I know that now you would have a lot of questions to ask about this topic that we are discussing. So you can reach out to us on this number 03029086607. Let me take it again, 03029086607. Call, talk to us. Emmanuel is here to answer all your questions. You can also send your WhatsApp messages on 05023470774. 05023470774. Right. So you can continue with your...
So some people to become irritable. Somebody who is so jovial, who is okay with you, now becomes so angry at the slightest thing that you do to him or her. So all this are signs and symptoms that you should look out for in people with mania. So the depression side, you know, somebody who is very active, goes to work every day, she can't do anything in life, so she has to stay home. She has to lock herself in a room. Some even neglect their family responsibilities. So that is another form of it that you also look out for. Because people, you know, some people can be sad. As a family member, it is okay for you to be sad. And there are stages in grieving. Some have to go through a lot till you get to the acceptance stage. But people who this illness can't reach the acceptance stage. They are fixated at the depressive stage, which does not help them and destroys almost every aspect of their life. But then there is help.
I see. So let's talk about some of the help available.
All right. So you need to seek for professional advice and professional to come in and look at the situation, because before bipolar is diagnosed, there are things that we need to do to ascertain the diagnosis.
Right.
Things like history taking. You should be able to take your history from your childhood to your adulthood to know the things that happened over set periods, so you were old enough. And also there's something we call mental status examination. So we need to ascertain your mental state at that time. What is happening? Are you able to sleep? Are you able to differentiate reality Are you able to concentrate? Are you able to, you know, accept nature as how it is?
Right.
And these things are also part. But then the treatment, we have medications to help you with bipolar. Yes, but that one will be prescribed by doctors and professionals. So you can't just go to the counter then ask of any medication. You need to come to the hospital for either hospitalization or treatment. So medications are available. We have the mood stabilizers. We have the anxiolytics to calm you down. We have the antidepressants. They are all there to help you. There's something we call talk therapy.
Right.
The psychotherapy. Sit with a professional. Start to tell him or her about your issues, whatever you're going through. They will help to reorient your mind, help to calm you down, and help to ascertain the cause of this illness and help you.
Right. Ima, the world. The moments we diagnose someone or we get to know that this person has bipolar, then the dream, we start saying that, okay, so he or she is mad. Now, if you have bipolar, does it mean you're mad? Before
I go to that, I want to tell the public that there's a thin line between normality and abnormality. Anybody can tilt at a point in time. So we are all not okay at a time. Because at any point in time, you can tilt to this state. Yes. So
and what can make you tilt to that state? You find say, for now I'm okay. I'm talking all right. I'm going about my normal activities. Then all of a sudden I tilt.
Some environmental factors, like you have a loved one, then all of a sudden the person passes on.
Yeah.
The grieving can even make you go that state.
Right, Ima, there's a caller on the line. Let's talk to Grace. Hello, Grace. Good morning. Right, we lost her, so continue with your subject.
Yes. So, assuming you have just a parent left, this person is taking care of you, taking care of your education, your every aspect of your life, and all of a sudden, this person passes on. Yes. So you can think of it, the grieving aspect. Some can take a week, some can take even a month. Forever.
Yes.
And the person will not be in a good state unless you seek for professional help. Then at least we can manage you. And don't forget, these things are not cured. So there's a need. There's a need for you to take care of your mental health.
Right. Ima, hold on. We have George on the line. Hello. Good morning to you, George.
Good morning, madam.
Right. I hope you're doing well.
My greetings to your viewers and everybody.
Right. I hope you're doing well.
Yes, please.
We bless God. Please, Ima is here to answer all your questions. You're on air.
Yes, please. I want to ask.
Right.
There is this young man I recently visited our church. And then we realized that he was very associated and very involving in what was going on. So I have been observing him for some time. Then later on, we saw that it's like he had himself from every activity that was going on in the church. So then I decided to investigate and find out if he has some problem or issue. So later on, I discovered that before I confirmed that he has been having some issues before. So the problem was that even if you try to get closer to him and to investigate how he's feeling, it's like he becomes so offended, like you have discovered what was wrong with him and you are coming in. So when that happens, it becomes very difficult to get closer to see what kind of assistance you can give to this kind of a person. So in this situation, what do you do?
Right.
Because when you see that when you are talking to him, so he said, I don't have problem. He doesn't accept that he has problem. He doesn't accept. So how do you help such a person?
Okay.
Thank you very much.
Right. Thank you so much for calling, George. Emmanuel will take that up.
Thank you.
So with this, this person is living in a state of his own fantasies. He thinks everything that is going on is okay with him and doesn't need any help. So we need to try because, you know, at that time, the person is not in the right state of mind. So the person might feel that anything that he does, it's okay. So we need to come in, take him to hospital and do our diagnosis. Make sure we know that this is the cause of it.
Right.
You know, as he said, the guy was very sociable, doing everything in the church, and now he's withdrawn. Yeah, so that's
right.
aspect.